Washing my hands. Hello, my name is Michelle. I'm your nurse today, and I'm here to do a physical assessment on you. Is that okay?
Yes.
Okay, and I'm going to check your wristband. Can you tell me your name?
Malone Smith.
And your date of birth?
March 7, 2001.
Okay, and do you know where you are right now?
The hospital.
And do you know why you're in the hospital?
For my physical.
Okay, and do you know what time of day it is?
In the afternoon.
Okay, and do you know who the president is?
Joe Biden.
Okay, so my patient is alert and oriented ×4. During our conversation, I assessed his speech and there was no slur and he spoke English. The next thing I'm going to do is I'm going to look at my patient, and my patient appears to be his stated age, which is 20 years old. I'm looking at my patient to make sure he is symmetric. I'm looking at his mobility. I'm looking at his use of any assistive devices. I'm looking to make sure that he doesn't have any involuntary movement. I'm also assessing, I'm looking at his facial expression for any distress or pain, and I'm looking at his behaviors, and they all appear to be okay. And so after that, I am going to look at hygiene, and I'm looking at his hair, skin, and nails. And right now his hair is covered, but if it wasn't, I would be looking for any flakiness, lice, or just greasy, dirty hair. I would be looking at his nails and making sure that his nail beds are clean. And I'm looking at his skin to make sure that it's dry and it's intact. After looking at his skin, I'm going to check his vitals. So the first thing I'm going to do is I'm going to check his apical heart rate. So when checking his apical heart rate, I'm going to start mid-clavicular and go down to the 5th intercostal space and listen for a minute. So I'll be listening right here for 1 minute. After listening to his apical heart rate, I would do his respiratory rate, and his respiratory rate should be within 12 to 20. After doing his respiratory rate, I would check his blood pressure. Okay, and so find his blood pressure, and I pump and listen to his blood pressure, and his blood pressure should be between 120 and 80. After listening to his blood pressure, I would do a pulse ox, and his pulse ox should be above 95%. After doing his pulse ox, I would take his temperature orally, and his temperature should be between 96.4 and 99.5. I also would check his radial pulse and compare it to his apical pulse, and I'm also assessing for the rate, rhythm, and force of this, and I would check it for 30 seconds and multiply it times 2, and that should be between 60 and 100 beats per minute. So after I've done his vitals and his vitals are all good, I am going to do an assessment of his head. So I'm going to have you sit up. So when looking at his head, I'm looking at the symmetry of his head. I'm looking at the shape of his head. I'm going to palpate his head for any masses, tenderness, or pain. After palpating his head, I'm going to perform a range of motion. So I'm going to turn his head this way, and I'm going to turn his head this way. I'm going to lift it up, lift it down, circular motion to the right, circular motion to the left. All right, range of motion of his head is good. After doing that, I'm going to palpate his sinuses and percuss them. Okay, so I've percussed his sinuses. His sinuses are okay. Now I'm going to check his eyes. So I'm looking at his eyes, and I'm looking at the alignment and the symmetry of his eyes. I'm looking at his eyebrows. I'm looking at his eyelids. I'm looking at his sclera to make sure that his sclera is white and not yellow, because that would be jaundice. I'm looking at his conjunctiva. I'm looking and to make sure there is no lacrimal discharge. And I'm looking at his pupils to make sure they are equal in size and round. Now I'm going to check to make sure that they are equal and reacting to light. So keep your eye open. I'm looking for constriction. Okay. All right, and can you follow my pen light? I'm going to do the accommodation. All right, and just follow it up and down, up and down, up and down. Okay, so I've done an assessment on the eyes. The eyes look good. Now I'm going to do an assessment of the nose, so I'm going to tilt you back. So I'm looking inside his nose. I'm looking at the mucosa of the nose, and I'm looking to make sure he doesn't have a deviated septum. I'm looking at how my patient is breathing, and he seems to be a nose breather, not a mouth breather. I'm assessing how my patient is breathing, if he's breathing with ease or not, and he's not using any of his accessory muscles to breathe. I'm going to ask the patient, do you have a cough?
No.
He doesn't have a cough, and his breathing is good. Then I'm going to move on to his mouth. And so when looking at his mouth, I'm going to ask him to open his mouth, and I'm going to be looking at his throat, the position of his uvula. I'm looking at his mucosa of the buccal and sublingual. I'm looking at his teeth and in his gums. And when looking at his teeth, I'm making sure that he isn't wearing any dentures. He doesn't have any missing teeth. He doesn't have any decaying of teeth. I'm looking at his tongue, and I'm looking at his lips to make sure they are both pink and moist. After looking at his lips, I'm going to look inside his ears. So when looking at his ears, I'm looking at the auricle. I'm looking to make sure there are no discharge, no lesions, and I'm going to push the tragus to make sure that there's no pain in both ears. So, good. No pain. Okay. Now I'm going to do an assessment of his hearing, and I'm going to do a whisper test. So I'm going to take a few steps back to make sure I'm about 2 feet, and I'm going to whisper a word to him. Are you listening to my word?
Cat.
So I said the word cat, and he was able to hear me as a whisper. And just talking to him and making sure he's able to follow the directions is another way to make sure that he is able to understand me and hear me. So after doing the ears, I'm going to look at the neck. So I'm going to palpate the carotid artery. After palpating the carotid artery, I'm also going to look for the jugular vein. And when he's laying flat, I should be able to see his jugular vein, but when he's at 45 degrees, it should go away. It should not be distended anymore. And that would indicate heart failure. After looking at that, I would look at his trachea to make sure that it was in line with his substernal notch, and that should be midline of his body. And after that, I'm going to palpate for his tonsils. Palpate his lymph nodes, and I'm going to do preauricular, postauricular, occipital, tonsillar, submandibular, mandible, submandible, anterior cervical, posterior cervical, and supraclavicular. So I palpated all of those, and now I'm going to move on to the chest. So I would be looking at his skin to make sure that it was not intact and that it is, that I would be looking at the color and the texture of the skin. I would palpate the skin to make sure there are no masses, no tenderness, no bulging. I am going to auscultate the lungs. So I would auscultate the lungs in a lateral motion. And so every time my stethoscope touches you, can you please take a deep breath? All right, so interiorly, his lung sounds are clear, and I would check his lung sounds posteriorly. So, also in a lateral motion. Okay, so also the lung sounds are clear and there's no crackles. Oh. Now I'm going to listen to his heart. So I would find his suprasternal notch and I would palpate to the second intercostal space, and that will be where his aortic valve is. So I'm going to auscultate his aortic valve. Then his pulmonic valve. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid valve. Fifth intercostal space, mitral valve. And his heart sounds good, no murmurs. After auscultating his heart, I am going to look at his stomach. So I'm going to inspect his stomach. I'm going to look at the symmetry, the contour, the pigmentation, the color. I'm going to check for any lesions. I'm going to look and make sure there's no pulsations, no bulges, and no masses. I'm going to look at the position of the umbilicus. I'm going to make sure there is no bruising around the umbilicus, because that would indicate Cullen's. And I would make sure there's no bruising on his sides, and because that would indicate Gray-Turner signs. The last thing I would look for would be any red dots, and that would be petechiae. So after inspecting his stomach, I'm going to auscultate his stomach in all four quadrants. And when auscultating, I would auscultate for a minute, and I am listening for normal active bowel sounds, hyperactive bowel sounds, and hypoactive bowel sounds. Okay. So bowel sounds are present and they were normal. After auscultating, I'm going to palpate lightly to feel for any tenderness, any pain, and then I'll do a firmer palpation of his stomach. Okay, and his stomach appears to be fine. Next, I would check his genital area, and so I would be looking for any lesions, any discharge, and the overall health of his genital area. And I would be assessing his urine and stool for the color and the character of it. So, finish that. After that, I would do a musculoskeletal check, and looking at him, I am going to ask him to stand up. Can you stand up for me? So I'm looking at his symmetry and his alignment. I'm looking at the symmetry and alignment of his upper extremities and his lower extremities. Can you take a walk for me? I'm looking at his evenness in stride, and you can walk back. And I'm looking at his balance, and there's good. I'm also looking to, you can take a seat. I'm also looking to make sure he doesn't have any tics or tremors. After assessing that, I'm going to palpate his upper and lower extremities to feel for any edema, tenderness, and muscle tone. So palpate both arms and both legs. Okay, after I've palpated, I'm going to assess for sensation. So can you close your eyes? Can you tell me what I'm touching?
My right arm.
So he said I'm touching his right arm. So he has a feeling of touch. After that, I'm going to do range of motion on his joints. So I do range of motion on his shoulders, on his elbows, on his wrists, on his hands, on his fingers, on his hips, on his knees, on his ankles, and on his toes. I'd also check for edema to make sure that, I would also check the capillary refill of his feet to make sure, and his hands, to make sure circulation was good as well. So, when performing range of motion, I would check for flexion and extension. I would check for abduction and adduction. And then I would do circular motions with his joints to make sure that range of motion was good. After assessing range of motion, I would check for muscle strength. So can you squeeze my hand? Okay, and can you put your hands up? Can you put it this way? Can you pull against my hand? And let me push against your hand. Okay, and I'll just do the same thing for the feet. Can you pull your feet against my hand? Can you push against my hand? Okay, so I assess his strength. After assessing his strength, I would do ballotments, and I'm looking for any fluid on the knee. And he doesn't have any fluid. And then I would do a carpal tunnel test. So we would do the Fallon's test first for a minute. So can you hold your hands like this? Good. And can you flip? Good. And then I'll do a Tennell's test. So for Tennell's, I have him here. Do you feel any pain? Okay, and so I've done a Tennell's test. And after that, my physical assessment is done. I would ask the patient if you need anything. Do you need anything?
No.
I would give him his call light and wash my hands, and I'd be done.